Lewis, owner of Emerson Grace Clothing Boutique, and Pat Martin, founder of Martin's Barbecue Joint and Hugh Baby's Barbecue and Burger Shop. Director Chief William Swan of the Office of Emergency Management and Nashville Fire Department, and Dr. Michael Caldwell, Director of the Metropolitan Public Health Department, are here to help answer your questions. We'll now begin with Mayor John Cooper.
We want to bring you the latest information on the COVID-19 virus in our community. Now, we are now 1 week into phase 3, and we're moving forward as part of our reopening plan. I begin with a word of thanks to everyone for helping keep Nashville safe. Your support has gotten us to this point, and we need you to stay vigilant. This virus is going to be around for a while, and we will continue to execute our plan to protect the health of all Nashvillians. This morning, our metrics look promising, and we're hopeful this trend will continue. Dr. Alex Jahanger will get into more detail in a moment. It's critical that we continue to follow the science and the data. It will inform every decision that we make. It's also been clear that Nashville has been a leader in flattening the curve in Tennessee. Back in July, we were the worst county in the state with new cases per 100,000 residents. Today, we rank 81st lowest out of 95 counties. In July, our cases per 100,000 were 64. Today, that's 1/4 of that number. In July, we had 5,800 active cases. Today, we are 1/5 of that number. Now, you may remember in the early summer, the urban and suburban areas saw most of the active cases, but things have changed. Now the virus is spreading more in the rural areas of Tennessee. The White House warned us. In July, Dr. Birx told us to wear masks, practice social distancing, and temporarily close bars and other businesses that could facilitate the spread of the coronavirus. She told us we needed to take action. And actually, by the time of her visit here, Nashville had already implemented all facilitate the spread of the coronavirus. She told us we needed to take action. And actually, by the time of her visit here, Nashville had already implemented all these public health protocols and more. Dr. Birx warned that it would take time to see results. So early action has allowed us to get the improved public health conditions we see today. We've learned a lot since the pandemic first hit Nashville, and as a result, we changed our behavior. We know wearing masks work. We know social distancing works. We know limiting the size of gatherings works, and getting tested works. At the same time, we also know that some businesses are suffering. Workers have lost their jobs. Small businesses have been hit hard. And that's why the more we continue to focus on the reopening plan and the more we're going to get it right. We're doing everything we can to bring people back to work safely. We're also committed to helping our small businesses through the CARES Act funding. On Tuesday, the Metro Council approved our plans to provide direct assistance to our community partners. $2 million of the federal relief aid will go to direct grants for small businesses, and another $2 million will go to direct grants for live music venues. You can get all the information about how to apply on our website at covid19.nashville.gov. Pathway Lending will be administering these funds, so business owners need to get the information and apply for this relief. In addition, $1.5 million of the CARES Act funds are earmarked for other programs to support small businesses. These programs will be administered by the Nashville Business Incubation Center, the Nashville Entrepreneur Center, Conexión Americas, and the Nashville Area Chamber of Commerce. Small businesses are a big part of what makes Nashville great. They are vital to our community. When they thrive, the city thrives. And I salute those who work in small business or own a small business, and I will stand with you and fight for you as we get through this pandemic. Today, we have two owners of local businesses who have worked hard to provide their customers and employees a safe place to shop, eat, and work. Kimberly Lewis is owner of Emerson Grace, a clothing and accessories boutique on 12th South. And Pat Martin is founder of Martin's Barbecue Joint and Hugh Baby's Barbecue and Burger Shop. Thank you for coming in today, and we'll hear from you in a moment. We'll also hear from Dr. James Hildreth, president of Meharry Medical College. And finally, starting today and every week, I want to put the spotlight on a local community hero, someone who is an example of helping others, and someone who is an example and an inspiration to others. Today, we honor Cody Hamilton, a nurse at the Vanderbilt University Medical Center COVID-19 unit. From the first days of the pandemic, Cody has been fighting on the front lines of the virus. Most people don't ever see what Cody sees. Most people don't ever deal with the challenges that he has to face and on a daily basis. Cody and his colleague provide a special combination of hope and healing. They are a lifeline for families of COVID patients who can't visit their loved ones in the hospital. Cody and his fellow healthcare workers are examples of the best this city has to offer. Thank you, Cody, and thank you, healthcare workers, for your service to our patients and this community during this crisis. You're saving lives. You are making a difference. And now I'd like to turn it over to Dr. Alex Shahanger, chair of the Metro Coronavirus Task Force.
Thank you, Mayor Cooper, and good morning. Here's the latest on coronavirus in Davidson County. We now have 29,915 cases. That is 125 new cases since yesterday, and 1,131 of those cases are currently active in our county. Our rolling 14-day average of new cases is 105.2. This trend has been stable now for nearly 3 weeks. Our new cases per 100,000 also remain stable at 15.5. The transmission rate has increased slightly to 1.01, and ideally we'd like to keep this at 1.00 or lower. There are now 125 individuals in Nashville area hospitals with COVID-19. This is slightly up, but it is below the 222 that we saw in our peak in July. Our hospital capacity is 15% and our ICU capacity is currently 16%. And as we've explained before, these numbers will fluctuate. And we haven't seen much change since the time of COVID. 283 Nashvillians have died because of COVID-19. The mortality rate in our city for all ages is 0.95%. However, in Nashville, those who are between the ages of 75 and 84 years old who contract this virus have a mortality rate of 13.5%. And for those Nashvillians who are greater than 85 years old, 15.8% of those who have gotten the virus have died. 15.8%. Now, we're seeing the impact of this virus on the elderly and those with medical comorbidities. Now, our 7-day test positive rate is 3.6%. And last week, more than 26,000 Nashvillians were tested. Now, this past week, we hit a milestone in our fight against the pandemic. Excuse me. Over 400,000 400,000 tests in Nashville have been conducted for our residents. I can remember back in March when early in the pandemic, we were just looking for supplies. And in May, we celebrated when we hit our 50,000 milestone. And now just 6 months later, we have one of the most aggressive testing programs in our state, if not in our region. Now, this is a great resource for our residents. So if you have symptoms, have been in contact with anyone that has had symptoms, or are just concerned, please get tested. Our community assessment centers are open from 8 a.m. to 2 p.m. Mondays through Fridays. Tests are free and results usually come back within a day or so. One note though, this Monday, our assessment centers will be closed due to the federal holiday. So this week we're open till Friday, and next week we'll be open from Tuesday until Friday. One additional reminder, please get your flu shot. If you haven't gotten one in the past, this is the year to start getting it. This way we can protect our city against what some people have called the twindemic, a scenario in which we get an increase in both cases and hospitalizations of people who have both flu and COVID. We do not want this, and one way we can definitely prevent against the flu is to get the vaccine. Now, we have been in 1 week into phase 3, and we've gotten this to this point because of everything you all are doing. So please keep it up, Nashville. Stay at home and only go out when absolutely necessary. When you do go out, please keep your distance and please wear your mask and wash your hands. And if you're worried, please get tested. I'm very grateful for everything you have done, Nashville, and please keep it up. I now would like to introduce Dr. James Hildreth.
Good morning, Nashville. We're doing a great job. The metrics are looking really good. Our transmission rate is now 0.9. The percent positive is 3.6%. We need to be less than 10%, which is fantastic. We still got to get that last critical metric of cases per 100,000 down to below 10. And right now we're at 15. We can do this. You know the formula: mask, washing the hands, and avoiding large crowds, and we can get this thing where we need it to be. So we've got this, Nashville. Keep up the good work, and we're going to get through this. And get your flu shot, please.
Thank you, Dr. Hildreth. We'll now hear from Kimberly Lewis, owner of Emerson Grace Clothing Boutique.
Good morning, Nashville. I'm Kimberly Lewis. I own Emerson Grace in the 12th South area. And I want to thank Mayor Cooper and his office for inviting me to speak on behalf of some of the small businesses in our community. Most importantly, I feel really strongly that we are open today and thriving because we are following protocols. The protocols of wearing masks, of social distancing, of limiting capacity within the store, and really providing a safe and healthy environment for not only myself and my team, but also for the customers that come in to shop. We opened Emerson Grace 8 years ago, and the reason we opened really was for local love and support. And local love and support is really why we are thriving. They have been supportive while we were closed through our social media and really trying to support us while we were doing curbside delivery, or curbside pickup, offering front door delivery, as well as doing shipping. People don't really want to go out, and when they do, they want to feel safe. It is our responsibility so that we can stay in business and not close. Being closed is not helping anyone or any neighborhood. We want our neighborhoods to thrive. We want our customers to feel happy and feel a sense of normal within this new normal. So all I would like to suggest is that you continue to shop local, eat local, and support and play local, but do it safely so that we can all ensure the getting back to normal and have a thriving, successful environment. Thank you very much. And next, I'd like to introduce Pat Martin.
Hello, Nashville. Hope this finds you well. Mayor Cooper, thanks so much for having us down here and to be able to speak on behalf of what we've got going on here with the city and with COVID. I also want to thank you for supporting us locally the way you have and taking the measured approach that you have. I think that's been the way that we had to get to where we are now as a city. I know this firsthand. Have 6 restaurants, Martin's in town, and 4 Hugh Babies in town. And I know that the policies that we've taken have helped us get to where we can now actually sit here and say we're looking at a phase 3 and entering into phase 3. So it's very important that we continue this path forward. I know it so well because this has been a horrific last since March, several months, especially when you get into our sales dropping the way they have and the impact the virus has had on us and affecting our employees' lives. The biggest way that we're going to climb out of this is to continue wearing the masks. It's just plain and simple. Right now, it's the vaccine that we have on hand today, and it is vitally important if you want to support your friends and those who or the business that you shop at, to not politicize this. It's not a Republican or it's not a Democrat thing. It's not who you voted for. It's about wearing the mask. If we all wear the mask, we are going to significantly prevent the spread of this, and it enables folks like me and all the retail around Nashville to be able to open back up and go through phase 3. We do not need to go backwards. And if we don't continue to maintain our seriousness on wearing these masks and cleaning our hands, then our city governments, not just here in Nashville, but also in other cities, will be forced to bring us backwards, especially as we enter into the flu season and what a lot of the professionals are anticipating another spike in the virus. So please, 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 especially as you come in our restaurants, we are enforcing it that you wear your masks. And that's the best way to help us if you can do that. Listen, I want to again thank Mr. Mayor, Alex, you. It's great to see you again. And also the Nashville Convention and Visitors Corporation, the support they've given us is just locals here. So thank you very much. And please wear your mask.
Thank you, Pat. We'll now begin taking media questions, starting with Harriet Wallace at Fox 17. Harriet.
Hi there, and good morning. I've got a couple of questions. My first is for Mayor Cooper. We talked recently, and you had mentioned that as long as we see about 60 new cases a day, we could be well on our way to advancing in the reopening, moving on. We see today 125 new daily cases, and we've seen a couple of days since then increase. Can you speak to why you all maybe are seeing these increases and what this will mean or could mean for advancing into phase 4? When could that even happen? And then for either the business owners, if we did have to revert, explain to us what that could mean for your businesses. You all have made it okay, but can you survive another revert in terms of going back in the phase reopening? Thank you.
Thank you, Harriet.
Thank you, Harriet. I'm going to actually ask Dr. Jahanger to elaborate a little bit further on your theoretical question, which my short answer is we're going to wear a mask. We're going to socially distance. We're not going to go backwards because we're all going to participate in creating a healthy future for our city. I mean, we can do it. We can control the virus. We don't have to have the virus control us. This is a great moment. It's been very hard on everybody. Together, we have learned over the last months how to do it. The last couple of months worth of data prove that. Let's just stay on it. And if we do that, we've got a great path going forward. Everything is opening up. Let's do it together. Let's do it carefully. And we're going to control the virus here, and we're going to have a super future, and we're all going to do it together.
Harriet, excuse me. Harriet, thank you again for your question about somewhat increasing cases. There has been a slight uptick in number of cases. I think the averages have been stable. Looking at kind of the number for the past week, there hasn't been a single like huge cluster or anything that we've seen. We have seen some increase in people getting it in households, so it's percentage of cases. So getting it from first contacts and so forth. But we'll keep an eye on it, right? Hospitalizations have slowly ticked up. Could it be? I mean, who knows, right? It could be a lot of coincidence. It could be something else. But I know our public health investigators are looking into it. But as of right now, there hasn't been an obvious source of this uptick. But we need to keep on it and stay vigilant. And then as far as the hypotheticals of when we'll roll to phase 4 or roll back, I think as our partners here said, Mr. Martin, Ms. Lewis, is that we are we want to stay vigilant, wear a mask, and we don't want to roll back. I think Mayor Cooper has been very clear. We want to turn that dial very, very slowly up so we don't have to turn it back. Because we all know that turning it back is probably even more painful and more impactful for our businesses than not moving quickly. So we'll have to see. We need more time before we start talking about a phase 4. But let's appreciate the fact where we are right now. Let's try to get through what we can do right now, and support local businesses, because I think that's so critical. They've been through so much right now. So thank you. And then will one of you like to answer Ms. Wallace's question? Thank you.
I feel as though we are onward and upward. And I'm really optimistic that we are working to not go back. And the way we're doing that is by just following the protocols. It really is pretty simple. And as a small business owner, I don't want to go back and I don't want to be closed. We will not be able to do the business that we do. And I'm fortunate that I have a business that's been around for 8 years, and there are other businesses that don't have the same amount of support and local growth that I have been able to experience. So this is really about everybody and not just me and my business. This is about all of the businesses that have decided to invest in Nashville and our role of keeping our employees employed and safe, as well as the customers that come in. So I'm really optimistic that we will not go backwards if we all can just follow the protocols, wear the masks, so that we can continue to move forward. Thank you.
Thank you. Our next question comes from Mariah Timms at the Tennessean. Mariah?
Good morning. I have a couple questions this morning. Speaking of where we are with phase 3, we've seen a handful of citations over the past few days since we just moved into this phase of restaurants and bars that have not quite been following the requirements. I guess this question is for Mayor Cooper. With the news that we may be adding more people who can help enforce that, do you see a shift from the sort of opting in that's gotten us here away from that and more into educating and enforcing, seeing more citations as we go? And then the other, one more question. There's been some news this week about the Titans possibly breaking protocol and causing an outbreak among their team and staff members. Do you have any comments on, if you're concerned that they may not have been following protocols and what that means for Nashville overall?
Thank you.
Thank you. As for the Titans, we, of course, hope they recover soon. And of course, we want football back as soon as it is safe. And I know they're going to work hard with that with the league. And it's an outside activity, and fans can be socially distanced. And again, we hope they recover soon. And it's a challenging year, and they've got some challenges. Now, in terms of, I think your question about additional enforcement, I want to clarify for the community. The additional enforcement really is on an as-needed basis. It is the platform to educate and to converse with people in real time. And this is including Metro. It's really now including Metro employees who are already out and on site. So probably 2 examples are important for people to understand. This allows, once they've been trained, for inspectors, codes inspectors who are on a building site, also to come in about public health. That's just an efficiency that needs to happen. A transportainment official from our licensing committee also can talk to transportainment vehicles about public safety. seems obvious to everybody, but you know, government in a way can be very in your own lane, and this ends up being an efficiency using current Metro personnel also to help with the health messaging. The education plan, of course, is very important, and the fact is we all need a little reminding from time to time, and if we get it right, we can be really on the rebound. And that's what we have to do is all voices, all resources, getting it right and to give people uh, careful educational reminder from time to time.
Our next question comes from Elizabeth Lane from Channel 2.
Hi, good morning. So just switching gears a little bit, we just got the announcement that the second presidential debate will now be virtual. Wanted to get Mayor Cooper's thoughts on Belmont moving forward and their plans to, at last check, they've said that they will move forward with an in-person debate here in Nashville. Thank you.
Thank you, Elizabeth. I don't know that I can shed any light on it. This is all breaking news. It's an unprecedented year, an unprecedented challenge. Our thoughts with President Fisher and Belmont. He gets an additional challenge. We're going to be here to support them. This is and maybe the platform for an important national discourse and conversation. Of course, it's flattering that they picked Nashville to be here. No better place, of course. But again, our thoughts with President Fisher, as I'm sure, assume that they're on a kind of a day-to-day basis. But I don't have any special information here. But we're going to support Belmont, and it's a national class university. They've done this before, and it is so great when it is able to happen.
Our next question is from Tosin Fakili at Channel 4.
Thanks for taking my question. I have two questions. The first is, with all the new dollars from the COVID-19 funds, the $2 million to the music industry, small businesses, and the 1.5, how quickly are they going to see this money? And I don't know if some of the small business owners there could talk about what this money will do for their business. And the last question is to Mayor Cooper. With news of the Titans, are you guys still okay with letting fans go to the game, especially if Sunday's game holds, or are you guys a little hesitant considering everything going on with the team? Thank you.
Thank you, Tosin.
Thank you, Tosin. I would love to get public health perhaps to comment a little bit more, and then our small business is today who are here. Part of this press conference is to send out the word for small business to apply. There's no reason that this can't go extremely quickly. You know, the money is here. We're ready to go. Get online, apply, connect with how we can help you. And then in terms of the Titans and the public health plan, and again, Dr. Jahanger is always, or Dr. Caldwell, happy to have his view. They submitted a really excellent plan. The plan is about keeping people in Nashville safe. There was never going to be any contact between people in Nashville and that kind of protected space of the players. I think every public health professional would say it's an extremely good plan. And so again, we're ready for that to proceed. And we're doing our job in keeping people safe. We're going to control the virus. The virus is not going to control us. We're going to get through this, Nashville.
Good morning. The Titans plan, the Nissan Stadium plan, is excellent. We were able to preview it in real time on Tuesday with the soccer team. Everything went well. We expect it to continue to go well. We can never provide a zero risk environment, but this is about as lowest a risk as you possibly can get. It's outdoor. Face masks are required at all times unless you're actively eating or drinking. Social distancing is really well enforced, and there are limited alcohol sales. So I feel very confident with what we observed on Tuesday, and I have no concern about any attendance moving forward.
To speak to the question about the funds and how they would help us, of course, they would be, any funds help any of us right now. We're all trying desperately every day to protect our own balance sheets, to keep our cash, because frankly, there has been so much abrupt change just since March. And the way we're all looking at each other as business owners is looking out, how are we going to get to next March? What's the next 6 months? We know what this past 6 months has been, and how we're going to get to the next 6 months. And I think that's where a lot of us are on our train of thought, so to speak. So this is strictly about protecting our cash and our balance sheet, our businesses, to ensure our health, to get through the other side of this thing. And so, of course, any funds help. So as Mayor Cooper said, the application's online, and it is vital that everybody go and fill out their applications and try to get it to help themselves.
Thank you. Our last question today is from Blake Farmer at WPLN.
Thank you. Can we get an update? I assume this is a health department, Dr. Caldwell thing, but on the health department's new role as schools really get back to in-person, both like coordinating, making sure kids who are in, quarantine households aren't in school, and these testing centers you all talked about, so teachers and students might have easier access. How do things change next week?
Thank you, Blake.
Thank you.
Hey, Blake. So what we, as public health, what we're doing is there is going to be increased access to testing. There will be, I know my colleagues in public health and working with my colleagues at the school systems to find, out of time mobile sites. So outside of the normal 3 assessment centers, have mobile sites that are set up at different locations around the city, probably somewhere on the school grounds, available to anyone, but really for any parents, students, teachers that want to have increased testing. So that will be there. I know the state's probably thinking of a way to keep students in class as well with testing. And I'll maybe defer you to them for more information around that. Beyond that, the way this public health system or department is functioning is similar as we've always been functioning. If somebody is test positive, the contacts will be notified. They'll be informed of how to best isolate, how the quarantine. And so nothing really changes per se, because each school system, whether it's MNPS or any of the independent schools, all have their own protocols that they've been working out very carefully with their specific public health teams or medical teams for each place. But what we will add additionally is the extra testing that I mentioned, and we'll get those plans out. So thank you.
Those are all the questions we have this morning. I'd like to thank Kimberly Lewis and Pat Martin for joining us today. As always, we're grateful to Tim Heaslip and our partners at Bridges for the Deaf and Hard of Hearing for providing ASL translation at these press briefings. The next Metro COVID-19 press briefing will air on Thursday, October 15th at 9:30 a.m. Thank you for joining us. This concludes today's briefing.